control and prevention. I'm delighted to be able to join everyone this afternoon to provide you an update on where we are with respect to COVID-19 for our state of Maine for today, Thursday, March 18th, 2021. I begin today's update on another sad note. The Maine CDC has received the reports of 2 additional individuals who have died with COVID-19. One was a man in his 80s from Hancock County. The other was a man also in his 80s from Piscataquis County. Their passings mark the 726th and 727th deaths associated with COVID-19 since the beginning of the pandemic. I would like to take a moment to offer our deepest condolences to the friends, family members, and entire communities of both of these men. We wish you our best, and we hope that your grieving process is quick. Overall, across the state, there are a total of 47,832 cases of COVID-19, an increase of 241 cases since yesterday alone. Of those, 37,042 are confirmed and 10,790 are probable cases. Cumulatively, since the beginning of the pandemic, 1,618 people have been hospitalized. And just in the past 30 days, 102 people have been hospitalized with COVID. Right now in Maine, 76 people are in the hospital. 23 of them are in the critical care unit, and 6 of them are on a ventilator. Turning now to some updates around testing. Our positivity rate in Maine has continued to increase. It now stands at 1.72%. That is for PCR tests over a 7-day basis. Again, that number is now 1.72%. And our testing volume in Maine for PCR tests has been largely steady at about 607 PCR tests for every 100,000 people. Our antigen test positivity rate has been a bit more stable. It's now at 5.02% on a 7-day basis, and we are conducting about 145 antigen tests for every 100,000 people in Maine right now. Again, that positivity rate has started to tick upward, as have the daily number of new cases, as well as very slightly things like hospitalizations. We're keeping a very close eye on these epidemiological trends. We've seen them unfold not just in Maine, but across other states, across the United States, as well as in Western Europe. Again, we are keeping very close tabs on them to see what might be causing them and where we might be able to intervene. Turning next to vaccinations. Overall, there have been a total of 545,102 vaccinations that have been administered across the state. Of those, 341,203 are first doses, and just over 203,000 of those are among individuals who have completed their vaccination series. Let me put those numbers in perspective. As of right now, 1 in every 4 Maine people has received a single dose of COVID-19 vaccine, at least their first dose, I should say. 1 in every 4 people. And about 15% of Maine people have completed their entire vaccination series. We are making progress on the vaccine and vaccination front, but as I mentioned on Tuesday, there was an error with respect to the program, the system that allows us to track who has been vaccinated and tabulate those data. The system is now back up and running, but providers will continue to report data into us from vaccines that they administered while the system was down. So those vaccination numbers can and should continue to climb as more and more providers are reporting data into us. Even though the data system was down, that did not slow down the vaccination process, nor did it slow down our ordering of more vaccine coming into the state. Next, I'd like to give you an update on an outbreak that we have opened since we last spoke. That is an epidemiological investigation into an outbreak at the Maine State Prison. Right now, we are aware of 12 cases among residents. We've been working very closely with the Department of Corrections, and in that respect have undertaken an effort to conduct testing widespread across the facility. Indeed, as a result of that testing, we detected 3 additional cases just since we opened the investigation, 1 this morning and 2 yesterday. We are continuing to work with our colleagues at the Department of Correction to, again, make sure that they have everything they need to conduct their investigation so that they can keep track of who's been exposed and in what ways we can reduce the likelihood that additional individuals may be exposed. We will have additional information on that work as it unfolds. Turning back now toward vaccines and what we are seeing for the coming week. Maine CDC today is placing an order for next week's receipt of vaccines. These are vaccines that will be arriving the week of March 22nd. Unfortunately, what Maine is receiving next week is not significantly greater than what we received this week. Overall, Maine will be receiving 35,190 doses of COVID-19 vaccine for our allocation within the state of Maine That 35,190 represents 1 additional tray of Pfizer vaccine. To put that in perspective, for next week, Maine will be receiving only 1,170 additional doses on top of what we received this current week. Now, we understand from our colleagues at the federal level that the subsequent weeks after next week have the potential to see increases in our allocation. But for next week, the week of March 22nd, what Maine will be receiving is again only about 1,170 additional doses for our allocation to healthcare providers across the state. Notwithstanding that, there will be allocations that will be direct from the federal government to, for example, our retail pharmacy partners, to Walgreens, Walmart, and Hannaford's, each of which will be receiving vaccine. In addition, the federal government is continuing to make direct allocations to our colleagues in the federally qualified health centers, for example, at PCHC and HealthReach. We're working with them to determine how much vaccine specifically will be directly going to those entities separate and apart from what the state of Maine receives. But again, we will be placing that order today for Pfizer, Moderna, and Johnson & Johnson vaccine. I want to just take a note to discuss the breakdown of those, particularly the Johnson & Johnson vaccine. Folks will remember that the week of March 1st, we got 11,500 doses of J&J vaccine, but we got no doses the subsequent week. And this current week, we only received 1,600 doses. That's the same amount we're going to be receiving next week as well. The J&J vaccine for a state like Maine holds significant promise. And we look forward to being able to have increased volumes of that vaccine here in Maine. But for this week and next week, all we received was 1,600 doses. And the week before last, we didn't get any. We are continuing to allocate that vaccine as efficiently and equitably as possible across the state. And again, if we have more information on allocations that are going directly to pharmacies and FQHCs, we will make that available. Before I turn things over to our colleagues in the media, I wanted to take a moment to answer 2 questions that have come into us about vaccines, especially over the past couple of days. The first question is, do I have to quarantine after I've been vaccinated? And the answer is no. That is, in fact, one of the tangible benefits of being vaccinated. Let me take a step back and recap. When someone has been exposed to the virus that causes COVID, they have to quarantine for at least 10 days to make sure that they don't infect anybody. But if you've been fully vaccinated, your risk, your likelihood of acquiring the vaccine and then acquiring the virus that causes COVID and then transmitting it to somebody else is very low if you've been fully vaccinated. Now, that's a testament to how good these vaccines appear to be. This means that, for example, if you have become a close contact of someone who has COVID, you do not need to quarantine yourself for 10 days if you've been fully vaccinated. That is a distinct and tangible benefit. And that's because quarantine is hard. It's long, it's disruptive, it can be solitary, and it, of course, comes with an economic cost from things like being out of work. But being vaccinated also opens up the possibility of other areas where you don't need to quarantine. For example, the possibility of more widespread travel. So, for example, right now, you have to test or quarantine if you're coming back to Maine after you have traveled to any other state other than a New England state. But so, for example, what if you're coming back from, say, Florida? Right now, you would need to test or quarantine if you're coming back to Maine from Florida, just to make sure you're not bringing something back with you, unless you are fully vaccinated. If you're fully vaccinated, when you come back from that trip to Florida, you do not need to get yourself tested or quarantine at home for 10 days. You can resume your life here in Maine immediately, provided that you've been fully vaccinated. But it's really important here to remember the word that is doing the work here: fully, as in fully vaccinated. Getting a single dose of the Moderna or Pfizer vaccine does not make you fully vaccinated. And the day that you get your final shot of Moderna or vaccine, or your only shot of J&J, is not the day that you are fully vaccinated. Being fully vaccinated means that there have been at least 14 days after your final shot of whatever vaccine you are getting. That 14-day period is the time in which your body is taking the vaccine, responding to it, and fortifying and building up your own immune system to be ready to fend off the virus if you happen to encounter it later. That 14-day period after your final dose is critical to being fully vaccinated. The second question that we've seen a lot, that I've gotten a lot of emails and outreaches on social media about, is the following. I'm really worried about the safety of the vaccine. And I'm also concerned that the vaccine was rushed. Why do I need to get vaccinated? Well, here's the bottom line. Let's start with talking about the benefits, both personal and to your community, that come from being fully vaccinated. One of them is what I talked about a minute ago. You don't need to quarantine. But let's talk about the other benefits. Your risk of getting COVID drops precipitously. And with that drop in getting COVID comes a drop in your risk of dying from COVID. But there are community level benefits as well. By being vaccinated, you help protect those in your life who are not able to be vaccinated or who are not yet eligible for a vaccine. In addition, as cases start to rise in Maine and in other parts of the country, getting vaccinated is a concrete thing that you can do to help keep folks in your community safe. But I understand that there are a lot of folks out there that have concerns. Let's talk about the risk. Dr. Tom Frieden, a former director of the US CDC, pointed out a couple of days ago that almost all the doctors who are offered the COVID-19 vaccine get the vaccine. That's telling, and we can learn from that. You know, one of the things I tell my family members is that when they're interacting with or talking to their doctor and they're facing a hard decision about what to do with their personal health, one of the things I recommend they do is to ask their doctor what she would do if they were facing that same question. And here we can see that when doctors are faced with the question or the opportunity of getting the COVID vaccine, almost all of them opt to take it. Now, regarding the speed of the development of the vaccine, that's something we've talked about, and I hear that concern. But here's the bottom line. In the development of the vaccine, Red tape was cut, but not corners. I think where all this takes us is the following. Imagine being able to gather indoors at your house with your friends and your family for a celebratory meal or a special event without needing to wear masks, without worrying about inadvertently transmitting or getting COVID. That day is coming, but only if we do what needs to be done to keep ourselves, our families, and our communities safe. And that entails getting the vaccine. The groundbreaking cooperation that led to the authorization of now 3 vaccines was cooperation between and among leading medical experts here in America and around the globe. And that cooperation is what led to these vaccines and is what makes a gradual return to normal possible. The speed of development of the vaccine was due to the sharing of research on a scale never attempted before. And every study and every phase of every trial was carefully reviewed and approved by an independent board of scientists as well as the US FDA. The process was transparent and rigorous throughout, with continual oversight and expert approval. If you're skeptical or concerned about the safety of the vaccine, I hear you. Thankfully, the likelihood of severe side effects is vanishingly low. And when mild side effects occur, they are a normal sign that your body is building protection to the virus. And most of those mild side effects go away in a matter of days. The vaccines are extraordinarily effective at protecting you from the virus. The bottom line is that getting vaccinated will help keep you, your family, and your community healthy and safe. With that, I'd like to turn things over to our colleagues in the media. The first question for the afternoon today goes to Chris Costa.
Hi, Dr. Shah. Thanks so much for taking our questions. Sorry to kind of put a damper on your very motivational speech there, but it sounds like there is certainly still a lack of supply of vaccine coming to Maine. Is there frustration on your end, especially given the acceleration of our rollout, that we're not still getting a larger increase in doses?
Well, Chris, I hear where you're coming from, but thankfully in this situation, our colleagues at the federal level have signaled to us starting in early March. They gave us a preview of what the month's vaccine allocation looked like. This is not a situation where 18 days ago, I was told that the supply would be doubling or tripling by March 18th, and it hasn't happened. Indeed, it's been the opposite. Our colleagues at the federal level have gone out of their way to let us know at the state level the vaccine supply is not anticipated to increase until the end of March or into early April. So in one respect, it's disappointing because, of course, our goal right now is to vaccinate as quickly and equitably as possible. And so I wish we had more vaccine, because that means we could push it to providers who could get it into arms as quickly as possible. But I'm also not frustrated because we've been told what to expect, and indeed what they've told us is what has transpired. I'm also encouraged because based on everything I've been briefed on, the vaccine supply is intended to increase later this month and into April. We have been taking steps to work with providers, hospitals, and vaccination sites to get them ready to scale up for that increase of vaccine so that when those doses come into the state, we can turn those vaccines into vaccinations as quickly as possible.
Excellent. I wanted to ask a quick clarifying question about federally qualified healthcare centers. Generally speaking, outside of the COVID-19 vaccine rollout, there are usually some eligibility requirements that somebody has to meet in order to get services there. What is the situation when it comes to the vaccine rollout? Can anybody go to a FQHC to get a vaccine?
Well, Chris, I want to back up. FQHCs are open to the community, and we'll get you more information on those requirements, and we'll make sure I get that over to you. But as it relates to FQHCs in particular, one of the benefits of FQHCs is that they are located in areas of need. For many Maine residents, the federally qualified health center may be their only access to healthcare in their entire area. And so for that reason, we've worked with them for weeks now to get vaccine into their offices so that they can vaccinate folks in their areas and communities. Right now, FQHCs are focused on vaccinating their patients, but becoming a patient of an FQHC is not an impossibility. And again, Chris, we'll get you some information around how to become a patient of an FQHC and what that really entails.
Okay, and then just lastly on cases, obviously we've noticed things are starting to turn in sort of a different direction, not the ideal direction. It also seems, according to the state's dashboard, that there's been an increase in cases lately among younger people around their 20s. Any idea why that might be happening? And I would imagine there's some concern there.
There is concern. Indeed, just an hour and a half ago, I was huddling with our epidemiology team to talk in general about the trends that we're seeing. And one of the items that we noted was the increase in cases among a younger population. Chris, I'll answer your question in two ways. The first is around transmission, and the other is around sort of the broader epidemiology. On the transmission point, we are concerned because the increase in cases among younger individuals could be a sign that there is fatigue setting in, that younger folks are gathering in the small groups that we saw and worried about back in October, November, as just one example. But at the same time, though, Chris, there is the possibility here that some of this is a epidemiological phenomenon. That is to say, because we have focused on vaccinating older Mainers, what we are left with, in a sense, is still the virus circulating, but not infecting and thankfully not causing deaths in older populations. The virus is still circulating, but because older Mainers have received the vaccine, and you've been putting up the numbers on your social media, on your broadcast about what specifically those numbers look like, but just to recap them for everybody, as of right now, about 1 in every 3 Maine people over the age of 60 has received their completed doses of COVID-19 vaccine. 1 in 3 people over 60. That means that even though the virus is circulating, it's not affecting or infecting older Mainers. As a result of that, what we're seeing is just the baseline transmission that was happening amongst younger Mainers. But because we look at these things on a percentage basis, because the percentage of older Mainers is so much lower, it just appears as if the percentage of younger Mainers is that much larger. Let me turn over to Patrick Whittle next.
Thank you very much, and happy Thursday. A couple of things. First, the state of Massachusetts recently released an updated sort of tiered schedule of when people will be eligible for the vaccine. Are there any plans to do anything like that in the state of Maine, or are we sticking with the age tiers for the moment being?
Patrick, one of the things that we do is not just take a look at the data around where folks are getting vaccinated and such, but I also try to make a point to check in with medical providers, hospitals, operators of large-scale vaccine sites, just to see how things are looking literally at the ground level. I try to visit those sites to get a sense of how things are unfolding. And I take those pieces of data and mash it up with what we're seeing at the macro level, what's on our dashboard. We've started to see some of the same trends that other states have seen, not to the same degree yet because of our population being older, but we're aware of those trends. I'm taking a closer look at them. No announcements on that at all today, but we are aware of some of those trends as well as the moves that other states have made. Again, nothing to announce today, but I am taking a hard look at those data.
Okay, good to know. And to follow up on Chris's question, with the increase in cases among younger residents, it sounds like this could be a product of the fact that more of the vaccine doses that have been allocated have been to older residents. Did I hear that correctly?
That's a hypothesis, Patrick. I don't. Okay. Or rather, let me say this. One of the things I think we've all gained an appreciation of with COVID is that in a very difficult, multifactorial, complex system like an outbreak or a pandemic, there are so many things going on at once. I think for me, there are two things that are going on with respect to the increase in cases amongst younger folks. One of them is the concern around COVID fatigue, mask wearing fatigue, gathering in small groups. But the other hypothesis or the other contributory factor is that there are more cases on a proportionate basis among younger people simply because there are fewer cases on a proportionate basis among older people. So I think it's both of those things happening at once, perhaps a little bit more transmission amongst younger people, but also just the arithmetic of when you take out older people from the pie, younger people is what you are left with as a proportionate matter.
Right, makes sense. One more thing. This is a question from a reader. The reader is a farmer, and they told me that the busiest season is ahead for them with cropping, and that most Maine farms add to their seasonal workforces and need industry service providers to be back on farms. They would love to know if there is an opportunity to accommodate agricultural workers without age restriction ahead of May. And this is me talking now. You might recall that at the onset of the pandemic last year, this was sort of some of the first cases in the state were amongst agricultural workers. So whether or not that supports the request they're making or not, we'll leave up to you.
Yes, that's something that we've been discussing and planning around as well. So certainly around providing vaccine to agricultural workers. Indeed, we've started having discussions directly and indirectly with one of the federally qualified health centers here in Maine that uses a fleet of mobile vans, and much of their patient population are seasonal agricultural workers. We've had conversations with them about when and how they could begin providing vaccine to that community. Now, you asked the related question, Patrick, about whether that would be within the age tiers or outside of them. At this time, we're sticking with the age tiers and not planning to make moves outside of them. But as you noted a moment ago, we're also evaluating the age tiers to see how we're doing and whether changes need to be made there as well. Let me turn over.
Thank you.
You bet, Patrick. Let me turn it over to Caitlin Andrews next.
Good afternoon, Dr. Shah. Two questions. I've been doing some reporting on the tribal vaccination efforts, and some of the tribes have been able to move through their vaccine priorities to the point where they're able to open their eligibility to their general population. Have you been following the tribe's vaccination efforts, and what do you think of their approach?
I have been following it here in Maine as well as both nationally, and I've been uniformly impressed with the way that tribal governments, tribal health centers have provided vaccine to the members of their communities, those who are both affiliated with the tribe, or in the case of some in Maine, those members who have deep connections with the tribe, even though they may not be tribal members. I've been, again, uniformly impressed with the way that they've taken the vaccine and turned it into vaccinations. Indeed, I think it's a testament to their commitment to their communities.
What do you think it is about their approach that has allowed them to move through it so quickly? Is there something about like their populations or just like how they've been delivering vaccines?
Caitlin, I don't want to speculate too much because I'm definitely not an expert on the nature of their communities or their approach. So I don't want to speculate too much. However, I did not long ago have the opportunity to have a conversation with Chief Hoskins from the Navajo Nation, and he described the process that they've been undertaking in Oklahoma on in their community. And he noted that there were some factors that were helpful. One was a high degree of trust among members of the community because the process was being undertaken by their own tribal health clinic. Another was the ease with which they were able to communicate with members of their tribe, as well as the centralized nature of their healthcare system, all individuals coming under one healthcare unit. So I don't want to speak too much because I don't want to hold myself out as an expert in their healthcare system or in their vaccination approach, but suffice it to say, based on what Chief Hoskins noted, it's been a remarkable success.
Thank you. And my second question is that I see in the allocation tally for this week that 200 doses are going to the Department of Corrections. I assume that those are for the prisoners that will start to be vaccinated. And I was just wondering if you could give me some more details about how the state is going to be tackling vaccination for them.
Sure. So you are correct. Of those 200 doses, approximately 150 are allocated for residents of the DOC facilities who are 60 and over. There are some other members of the DOC community, frontline staff, who have also expressed an interest in being vaccinated. So some of those doses will be for them as well. And we've been working pretty closely with DOC. As I've mentioned a couple of times on these meetings, I have almost daily phone calls. In fact, I have daily phone calls with the Deputy Commissioner Ryan Thornell at DOC every single day to talk about all matters DOC. Recently, that's been around planning for and launching the vaccination process. Much of the vaccinating itself will be done by the healthcare providers at the DOC facilities, but we've been working with them around getting the vaccine to them, getting the accurate counts, figuring out where it needs to go. And that process will begin as soon as the vaccine is delivered. J&J vaccine doesn't typically arrive until Wednesdays or Thursdays in states. So that's around when we would anticipate it beginning next week.
Thank you.
Thanks, Caitlin. Over to Evan Popp at the Maine Beacon.
Hi, Dr. Shah. Thank you. So I was looking at a recent paper that was published by the University of Maine. And according to this paper, Down syndrome is associated with like a 3-fold or possibly even 10-fold increase in COVID mortality. And that's as much or even more than the COVID mortality that comes with a decade increase in age. So I'm wondering, considering kind of that data, if Maine would consider offering vaccines to people with Down syndrome or other conditions with similar mortality rates, along with people who are 10 to 20 years older than those people.
Yep. Thanks, Evan. I've taken a look at that, maybe not that exact paper, but I've taken a look at other pieces of research around relative risk for individuals who are suffering or from chronic medical conditions, be it various different types of cancers, recently having a transplant, so on and so forth, as well as more recently, the analysis that's been done among individuals or around individuals who have Down syndrome as well. And at this time, we're not making any changes to the age-based allocation that we've talked about previously. But let me just acknowledge that doing so entails, it's not news that folks want to hear. We acknowledge that there are some groups that have somewhat higher levels of cases of COVID-19, or in some cases, higher rates of hospitalization. But even at that point, age still becomes a useful factor in how we move through our vaccination process. And so at this time, Evan, even though I know it's not the news that folks want to hear, and for many families in Maine, this will be unwelcome and be met with some degree of chagrin. At this time, we're not going to be moving toward groups outside of those in the age tiers.
And so I guess inferring from your use of the phrase "at this time," is that something that may change if the supply of the vaccine were to increase?
I don't think it's going to change anytime soon. Again, I'm always looking at newer pieces of data to try to better understand where there may be pockets of risk and how we might be able to ameliorate that. So that's what I meant by "at this time," meaning I don't close the door to anything ever. Always, this is a scientific venture, and so we're always looking at new and different pieces of data. But right now, we're not making any changes to the age-based approach, and that's not so much that's not related to vaccine supply. It's just more related to where we are right now.
Thank you.
Mm-hmm. Thanks, Evan. Over to Brian Sullivan.
Thanks, Dr. Shaw. AstraZeneca vaccine making some headlines today. News that it's going to maybe be distributed to Canada and Mexico. Any word on how it may be used here in the state of Maine and the weeks ahead? If it
Sure.
does. Yeah.
Sure. Yep. Brian, let me start with the very important point, which is that vaccine has not been authorized in the United States. Indeed, the manufacturer, AstraZeneca, in partnership with Oxford, have not even applied for authorization in the United States. That application may come in days, weeks, well, not days, but weeks from now. And then the review process by the FDA may take what it has taken for the first 3 vaccines, which is to say a couple of weeks thereafter. So we are still a little ways away from the Astra vaccine being authorized in the US. That being said, the vaccine is already one that we're planning around because it sort of sits in between the J&J vaccine and the Pfizer and Moderna vaccines. It is a 2-dose series, but it's 2 doses that don't require being put in a freezer, let alone an ultra cold freezer. So again, it kind of occupies that middle ground between the J&J vaccine, which we are starting next week, for example, to use around homebound Mainers, because the J&J vaccine is one that we can give to public health nurses, EMS clinicians, independent pharmacists, to start going door to door to homebound Mainers because of the relative ease of using the J&J vaccine. That's something we're starting next week. But the Astra vaccine sits in between that and the Pfizer vaccine, which of course has very strict cold temperature requirements. So the Astra vaccine opens up this middle ground of uses in between going out in the field and needing an ultra cold vaccine. That's how we are starting to think about it. But again, we are likely several weeks away from any authorization.
You mentioned numbers and positivity rates creeping up, daily cases. Do you draw any parallels, or can you draw any parallels from the last year when you saw similar numbers like this, things that preceded it and followed it by chance?
Well, what's interesting, Brian, is that there have been some instances in the past year where we saw this beginning of an uptick, and it turned into be the beginning of a significant uptick, say back in October, November, where the early days were then followed by a sharper incline. But there have also been instances in the past year, Brian, where this small uptick then went back down. So it's too early to tell where we are going. Of course, we're hopeful that it doesn't turn into the beginning of a spike, and epidemiologists have different views about where this will mean. Folks have heard me say this before. Hope is not one of our actionable strategies in public health. So this is an opportunity for me to note for folks that if you're in that group that is just tired of COVID and that fatigue is setting in and you're ready to chuck your mask in the trash, now's not the time to do that. Now's the time to double down, continue wearing a mask, continue distancing, and if and when you become eligible for a vaccine, make that appointment to get your shot.
And just real briefly, you said it a couple times here, no change in the age tier yet, or the what's currently eligible. If something was to happen, would it just be bumping up people that are 50 and up a little bit sooner than April? Would that be the next logical step that would happen, maybe a little bit sooner?
That's right, Brian. Again, we're taking a hard look at the data. I'm talking with folks who are operating and running the large sites to see what they're seeing in terms of slots, how quickly those slots are being filled, whether if we move to another tier, that would overwhelm them and potentially crowd out others who are in their 60s and 70s. That's the balance that we're trying to achieve. We don't want any slot to go unfilled, but at the same time, we also don't want to crowd out those who are 60, 70, 80 from getting their shot. So that's the balance that we're trying to strike. And I'm taking a hard look at those data. Our entire team is. Again, nothing to announce right now, but if we were to make changes, it would be an acceleration rather than a change in anything else.
Thank you.
Mm-hmm. Let me turn things over to Amy Brown next.
Thank you, Dr. Shah. I have a couple of questions from listeners today. The first asks whether there's been any reconsideration about reopening bars on the 26th, given that we've repeatedly heard that they're a very high-risk venue. The listener asks, what's the science behind opening when our case counts and hospitalization rates are no longer decreasing?
Mm-hmm. Well, I think there's a couple of things to note. The first is that although bars are slated for reopening soon, they are slated for reopening with safety measures in place. So it's not the bar of St. Patrick's Day 2019. It will look and feel different. There will be physical distancing requirements in place, so on and so forth. So I think that's the most important piece of this. The other, though, Amy, is that I think that's the critical piece. It's not bars as we remember them, perhaps from 2019. They will look and feel different while we are still in the mix of things.
bars that have opened in other states, though, in 2020 or early 2021 have theoretically had those things in place and they haven't been enforced? Is the state planning to be more proactive about enforcing that so we don't have the same outcome that they've seen in other places when they've opened bars?
Well, I think, again, the bars that we saw back in the early phase of the pandemic in February, March, April, May of 2020, that's a different scenario from what we are contemplating here. I think our approach to enforcement has been robust throughout. And if we find reports of systematic noncompliance with things like physical distancing, we won't hesitate to step in.
Okay, thank you. And the other listener asks, if all of the adults at a small gathering have been vaccinated, if they're fully vaccinated, do the kids that are at the gathering need to be masked? Do the adults that have been vaccinated need to be masked as well as the kids? Since the kids aren't as prone, they ask, can they join in without being masked with all the adults that are vaccinated?
Yeah, that's a good question, Amy. So the bottom line is no. The guidance there from the U.S. CDC as well as the scientific brief that accompanied it was clear that that guidance to gather in groups in private residences is one where everybody who is in attendance has been fully vaccinated. If there are kids, or no matter their age, even though kids get COVID a little bit less than at the rate of adults, they still get it. And there have been consequences as a result of that. Thankfully, it's rare, but they're non-zero. So the guidance only applies if every single person at the gathering has been fully vaccinated. Of course, right now, neither of the 3 vaccines is authorized for use in children under the age of 16. And so if there are kids present, that guidance doesn't apply.
So then they should not be gathering at all, or they can gather and everyone should be masked? I
mean, everyone should be masked and spaced out then.
Okay, thanks.
Or gathering outside.
Great, thank you.
You bet. Let me turn it over to Eric Russell next.
Thank you, Dr. Shah. I wanted to see if you have any updates on the variants in Maine. I think the US CDC site has 5 of the B117 and 1 of the B1351 here in Maine. I wonder if you have any updates on that and whether or not you think there's any correlation between the variants and some of these recent upticks in cases.
Yeah. Okay. Good. Very good question, Eric. Thank you. Let me give you the updates. This is based on data that has just been reported in from the laboratories, now a network of laboratories that are doing the sequencing. So here's where we are with respect to the variant counts. As for B117, there are a total of 7 samples that have been identified in Maine. As for the B1351, 1 that has been identified. The 351 is the variant first identified in South Africa. And as to the P1 variant, first identified in Brazil, we have identified no cases of that. But to the question you raise, Eric, as I referenced a moment ago, I was meeting with our epidemiology team to just break down the numbers. What are we seeing? What's going on? Is it more transmission? Is it what have you? We think that not just in Maine, but elsewhere, the variants are spreading. That is what they do. They are 40 to 60% more transmissible and contagious than the regular COVID vaccine or virus. But the extent to which those variants are accounting for the increase in cases in Maine, in California, and Florida, where have you, that's the harder question. I think it's happening, but I think that qualitatively, based on the percentages and the increases and the assumptions that we can put into a model to help us figure out, well, okay, if we've been testing 4% of our samples and have found 7 cases of the variant, what does that mean out more generally? We can model all that out, but as to the quantitative nature of your question, how much of the increase is because of the spread of more variants? I don't think epidemiologists have a great handle on that very relevant question yet. I've pinged a couple of epidemiologists outside of the state of Maine as well, friends of mine or colleagues I know in academia who really focus on this stuff. And I know they're trying to model it out and get better data. But at this time, for the question you ask, how much of X is driven by Y, there's still more research going on into that.
Okay. And the second question I had to do with deaths. And this is a harder one because, I know you guys report deaths when they happen, but also you do periodic sweeps of vital records. And so I wonder if you've noticed anything since that big January surge about deaths coming down or decreasing, or if you can tell us anything about that trend.
I can. Yes, indeed. Coming out of that same meeting, deaths have come down. Even accounting for the analysis that we do of vital records, which is important because we want to make sure we're getting the full and complete picture. Even accounting for that, the death rate has thankfully come down in Maine relative to where we were in December and January in that big spike. That's expected epidemiologically. Cases fall, then hospitalizations fall, and then deaths fall. But the other important thing, though, Eric, is the composition of who and sadly where folks are dying. In the past 30 days, one individual has died in a long-term care facility related to COVID, as compared to much higher numbers back in December and January. That's still one person too many, make no mistake. And we all lose a little bit when one of our elders in a long-term care facility dies. And all of us is just a little bit poorer as a result of that death. But it is different from where we were back in December and January.
Thank you.
Mm-hmm. And the final question of the afternoon goes to Allison Ross.
Hi, Dr. Shah. Thanks so much for taking my questions. Just two here. So to start, do we have any sense of where things stand with the percentage of educators who have gotten the vaccine?
Yeah, that's another great question, Allison. The answer is that we don't have a great sense right now. Sort of the way in which the educator childcare initiative was unfolded, it was effective immediately upon President Biden and the acting secretary of the U.S. Department of Health and Human Services. As soon as they announced it, it was effective immediately. And so as a result, what has happened is we're trying to get a better sense of who has been vaccinated within that category. When folks go to get vaccinated, we ask for a fair amount of data. We ask their age and their racial background and ethnic background and such things, but we are not required by the US CDC to ask them, nor do we ask them, for example, what their profession is. Are they a teacher? Are they a school bus driver? Or do they work in the cafeteria? We don't capture that data. No state does, so far as I'm aware, because it's not a requirement from the US CDC. So we're trying to think through how we can gauge what percentage of educators and childcare workers in Maine have received their first or maybe even their second dose of vaccine. We're looking at doing surveys and things of that nature, working with schools, working with the sites that have done those vaccines to assemble those data.
Great. And then just my final question here. Now, we've heard that you shouldn't get the vaccine if you are exposed or if you have the virus. But what if that happens right before your second dose? Should you still not get that second dose? And then do you have to wait and start the process over?
Okay, so that's also a question that's come up. Thankfully, it hasn't come up to us too often. So that's a good thing, Allison. It's not, thankfully, not something that is dominating our phone lines. The bottom line there is that you do not need to start the process over. That's a good thing. Once you've gotten that first dose, if you've gotten exposed in the interim, first of all, you still have to quarantine. As I mentioned a moment ago, just because you got your first dose doesn't mean you are exempt from quarantine after you've been exposed to somebody. But then your question is, do you delay that second dose or do you get it anyways? And the bottom line is that we've recommended that folks hold off on the second dose. The second dose can be administered for a number of days after the first dose. We recommend sticking with what the FDA has said, 21 days or 28 days. But even if it goes a bit longer, it doesn't affect the efficacy of getting the dose. So we recommend that you hold off until you've cleared your quarantine period. That way you're not exposing anybody when you go get that second dose.
Great, thank you.
Yep. Okay, well, thank you all for your time this afternoon. Just to go back to what we started and talked about a bit earlier, we know that there are a lot of folks that continue to have questions around the vaccines, as well as whether they should be vaccinated. And a lot of those questions around the safety, the speed with which the vaccine came through. But I just want to end on this note by noting the same thing, that the vaccines that we have today are the result of groundbreaking cooperation that led to the authorization of these vaccines. And this was cooperation between and among leading medical experts, not just here in the United States, but around the globe. And that work is now what is making the gradual return to normal possible. That speed of development that so many folks have written to me or tweeted to me about, that speed of development was due to the sharing of research never on a scale attempted before. And every study, every phase of every trial was carefully reviewed and approved by an independent group of scientists on the safety board, as well as by the US FDA. And as a result of that, almost all the doctors who have been offered the vaccine get the vaccine. When your turn is up, when your age is eligible, I urge every single person in Maine to do the same thing. Thank you all for your time this afternoon. We appreciate you taking some time out of your day. Look forward to talking next week. Of course, in the meantime, be kind and take care of one another. We'll catch up with everyone soon.